One of the common questions that we get from healthcare providers is, what are the Muslim dietary restrictions? It is actually quite simple. There are only two things that a Muslim is prohibited from consuming. Number one, pork and any pork byproducts. That means anything containing pork a Muslim cannot eat. And number two, alcohol and anything containing alcohol. Otherwise, Muslims can consume any types of fruits, vegetables, and meats, with one small caveat. If a Muslim asks for a halal diet and they strictly follow the diet regarding meat, they will prefer that that meat be slaughtered in the appropriate fashion. That meat is referred to as halal meat or zabiha meat. If you have questions about where you can find halal meat, feel free to contact us or your local Islamic center, as there are numerous halal grocery stores and shops across Oklahoma. How do these dietary restrictions impact medication and administering medication to a Muslim patient? If medications contain anything that has a pork byproduct or any type of alcohol in it, it's important to have a conversation with your Muslim patient and look for alternatives that they can take instead of those. Last but not least, while we're on the topic of food, some people ask me, what does Muslim food look like? Well, that's a tricky question because, as we've talked about, Muslims come from so many different cultural backgrounds. Therefore, when it comes to culinary preferences, it's good to have a conversation with your Muslim patients about the kinds of foods they may or may not prefer, especially when they may be in a hospital or healthcare setting for a prolonged period of time.